Magandang araw po sa ating lahat. Magandang gabi. Ngayon po, ituturo ko po sa inyo ang 7 types of hand washing. Yan po ang 7 steps of hand washing. Good day to everyone. My name is Donna, Roxanne Marinas, one of the trainees of Nurse Caregiver Management Alliance, Batch 8 of 2021. Home caregiving is more than just taking care of a senior or a person with disabilities. It is a place also where you can find love and companion. So to be a good caregiver, you should have these good qualities that you should adopt. So today, on this video, I'm gonna show and discuss to you the 10 good qualities or best traits of a caregiver should have. The number 1 quality is patience or pagpapasensya. Hi Auntie, wake up. It's time for you to take your medicine.
No, I don't want. I want to sleep.
Here's your medicine. Please take it.
No, I don't want.
Please na Auntie, so it will be better for you.
Why are you forcing me? I don't want.
This one is good for you.
Medicine for what?
It's medicine for your high blood and diabetes. So please take it.
Okay.
Alright, thank you. Well done, Auntie.
Okay.
Number 2, Sherry demeanor or pagiging masigla. Number 3, multitasking o paggawa ng isa o higit pa sa gawain. Hi Auntie, it's time for you to rest.
No, I want to watch TV. Can you pass the remote for me? The remote control?
Alright, here's the remote control.
Okay, thank you. Why the TV is not working? Wait, I want to go and check.
No, Auntie, please
Wait,
take a rest, then I open the TV for you.
Okay, thank
Alright.
you. Okay, thank you.
Alright, while you're resting, I need to fold your clothes. Number 4, able to think quickly or pagiging alerto. Number 5, punctuality or pagiging maagap. Number 6, willingness to learn or kagustuhang matuto. Number 7, being a good listener or mabuting tagapakinig.
Donna, this is your first day, right?
Yes, ma'am.
Okay, as a caregiver of my mom, I will tell you everything about her conditions, medicines, and her daily activities. And I hope you follow and listen carefully what instruction I given to you. Okay?
Okay, ma'am.
Okay. First, bring my mom for exercise. Okay? She can do massage sometimes for my mom.
Okay.
And the third, the important thing is my mom's medicine and food. Please please select the food that is good for her. Okay.
Okay, ma'am.
And then, if anything happen, please let me know because I'm not around. Okay.
Okay, madam. I
So-
will make sure your mom is in a good care, and if there's anything happen, I will call you as soon as possible.
Okay. Thank you, Miss Donna.
Thank you, ma'am. Number 8, kindness and empathy or kabaitan at malasakit.
Hey, Donna, where are you? Why are you so hot? You never opened the fan for
Yes,
me.
Auntie, what is it?
Oh, so hot.
Oh, wait, I have to open the fan for you.
Faster! So hot. Wow. Good.
So now, how are you feeling, Auntie?
A bit okay. Why you didn't open the fan just now,
Oh, just now I'm doing something.
Okay. Now I'm okay. Thank you
Alright.
so much. Thank you.
Number 9, willingness to go extra mile.
Hi, Donna. Where are you?
Yes, madam.
Okay.
Yes, madam.
Now, are you ready to go with my mother's place?
Yes, madam. My luggage are complete.
Oh, okay. Because now the doctor called me that needs someone to take care of my mom in the dialysis center. And then, everything is okay. Your ticket, your papers, everything will be okay already. So now, you can take care of yourself, take care of my mom there at the dialysis center, and then anything happen, you let me know. Okay. This is your ticket.
Okay, madam. Anything happen, I will let you know and call you immediately.
Okay, thank you. Please
Okay,
take care of
madam.
yourself and my mom in dialysis
Okay.
center now.
And number 10, able to take responsibility or responsibilidad. Patient care transfer can be defined as moving a patient from one plant to another service. The most common patient transfers are from bed to a stretchers and from bed to a wheelchair. While seemingly intuitive, successful patient transfer rely on understanding on each patient's needs while simultaneously adhere to evidence based on the guidelines. On this video, I'll be touching on one of the activities of daily living, transferring from bed to wheelchair with care assistance. Moderate assistance requires for both caregiver and patient to contribute equal amount of effort in the transfer. Hello everyone! Today on this video, I'm gonna show you on how to transfer a patient from bed to wheelchair. Before we begin, please make sure to provide privacy by closing the doors or curtains and doing the proper hand hygiene. Introduce yourself to the patient and explain to him or her the full procedure of the transfer. On this case, the patient bends the right knee to turn left, and your right hand holding the opposite shoulder and left hand holding onto the patient's opposite hip. Gently lower the patient's legs off the side of the bed with your left hand while supporting her right shoulder blade with your right hand. Do let her rest him or her for a moment if he or she is feeling dizzy. Shuffle the patient's body towards you so her feet are flat on the floor. Prepare the patient for lifting. Lean patient forward before lifting the patient and turning the patient toward the wheelchair. During the turning, gently lower the patient into the wheelchair and place his or her in a comfortable position. Lock the brakes of the wheelchair and you and your patients are ready to go. I'm Donna Roxanne Marinas, one of the trainees of Nurse Caregiver Management Alliance, Batch 8 of 2021. So today on this video, I'll be performing on how to do the bed bath. Bed bath means washing someone in bed, and a bed bath cleanses the skin and helps the skin free on infection. It also helps to relax the person being bathed and help him or her feel better. Hello sir, good morning. I'm Donna, the assistant caregiver for you today to do the bed bath. But before we proceed, may I know your name, sir, please?
My name is Jazz.
And then your birthday?
25/10/99.
Before we proceed, may I know, do you have any weakness or pain? So if have, can you rate for me from 0 to 10?
0.
So 0 means you're not feeling any pain at all. So we are now ready for do the bed bath.
Okay.
Okay, thank you. Assist the client to a comfortable position at the side of the bed closest to you. Loosen the top sheet and replace it with bath blanket. A bath blanket provides warmth and privacy. Don't too heavy your arms. Ayun, making it heavy. Let's assume that our client had removed his clothing under the bath blanket. Remove pillow. Replace it with a bath blanket under the client's head. Place towel over client's chest to make it easier to wash ears and neck. Wash and dry the eyes from the inner canthus to the outer canthus using separate corner of the washcloth. Using circular or S strokes, wash the face using soap with client's permission, rinse, bath, and dry. Clean the area behind and around the client's ears, soap, rinse at least twice, and bath and dry. Remove bath blanket from arm farthest from you. Place towel lengthwise under arm. Wash with soap and water using long, firm stroke from distal to proximal. Raise the support arm above head while thoroughly washing axilla. Rinse, bath, and dry. And repeat the procedure on the other arm. Immerse both hands in water 3 to 5 minutes. Soap and wash hands with washcloth, paying attention to the interdigital spaces. Rinse hands and remove the basin, then bath and dry hands with towel. And repeat the procedure on the other hand. Place bath towel across the chest and abdomen. Soap, rinse and dry chest, paying attention to the area to the umbilicus and under the breast. Bath abdomen, paying attention to the abdominal folds, stroke from side to side, wash, rinse, and dry well. Cover chest and abdomen, expose near leg by folding blanket toward midline. It prevents unnecessary exposure. Flex the leg at the knee and drape other leg and genital area with bath blanket. Wash the distal to proximal end using long firm stroke, paying attention to the popliteal area. Rinse, bath, and dry. And repeat the procedure on the other leg. Place basin line with towel in bed. Raise lower leg and slide under lifted foot and soak well. Soak and wash, making sure to bath between toes. Rinse and dry well, and repeat the procedure on the other leg. Assist the client in sideline position. Place towel lengthwise alongside. Wash, rinse, dry back from neck to buttocks using long, firm strokes. Pay attention to folds of buttocks from anus. Give back rub. Change bath water if necessary. And you may wear disposable gloves if necessary for preventing contact with microorganisms and body secretion. Skin folds from buttocks from anus may contain freckles, secretion that form microorganisms.
For cleaning your patient's private party, you may ask him or her if they could do it by themselves for their own comfort and privacy.
Thank you for watching my presentation on how to do a bed bath. Hello everyone, I'm Donna Roxanne Marinas, and today's video I'll be demonstrating the proper ways of sterilizing feeding bottles. So today, these are the materials that we're going to use. We have here the bottle organizer, the drying rack, the baby bottles, thumb, sponge, the bottle brush, soap, and the two basins for rinsing and soaping. And we have here our casserole for boiling the feeding bottles. Before doing the procedure, I'll make sure that I have done doing the proper hand hygiene. Making sure also that our feeding bottles are empty and there's no any milk left over inside the bottle. And now we proceed to disassemble the bottles from the cap, from the ring nipple and the nipple, and the bottles itself. Use the bottle brush to clean the bottles using the twisting motion. It softens the milk residue stuck on the wall from the top to bottom of the bottle. Clean the cap, the ring nipple, and the bottle using the sponge. You may clean the nipple by your hand by pushing the nipples outside and inside. By using the nipple brush, you may also use it inside for assuring that there's no any milk residue stuck inside the nipple. Please make sure that you're not pushing too hard that may rupture the nipple hole. You may rinse the feeding bottle twice or thrice, depends if you see that the feeding bottles are totally clean. And now we are ready to boil the feeding bottles. First, we have to make sure to on the stove and put the water on the casserole. Let's assume that the water is boiling. We may now proceed to put the hard bottles first. To avoid for the soft things, at may it will melt or dissolve. We may boil it for 5 minutes. After 5 minutes, we may put on now the nipples, because the nipples are easily gets melt or dissolved. Cover the casserole and wait again for another 5 minutes. After 5 minutes, we are now ready to take out the bottles and put it on a drying rack. Using the tongue, carefully remove the feeding bottles. Put it on a drying rack to drip dry. So let's say that the feeding bottles now are totally dry. We may now assemble them back and put on the bottle organizer. On the bottles, from the ring nipple and the nipple, so assemble them, put the cap, and you may use it on the next feeding. And this is how I do the proper procedure of sterilizing the feeding bottles. Now we move on how to burp your baby. For burping your baby, there are two techniques that we are commonly used. One is over the shoulder and the second technique is on the lap. For over the shoulder procedure, first we're going to put a burping cloth on our shoulder, just in case that our baby will speak. Next, we're going to take our baby. Hold your baby up into your chest so the baby is facing towards you with your arm tucked under the baby's bottom to support. Using your dominant hand, tap gently and firmly tap your baby's back. Once you heard that your baby done burping, you may put him back into the cradle position. On the lap technique, first, place a burping cloth on your legs. Rest the baby's chin on your hand supporting the neck. Pat the baby's back gently and firmly or stroke in an upward position. And this is my presentation on how to sterilize a feeding bottle and how to burp a baby. Hello everyone, I'm Donna Roxanne Marinas, one of the student trainee of Nurse Caregiver Management Alliance here in Malaysia. And today's video, I'll be demonstrating on how to do the infant bathing. The best time for bathing your baby is from 6 a.m. to 10 a.m. in the morning. The bathing place should be done on your countertop or on your kitchen area. The water temperature should be 29.4 degrees Celsius by checking it using your elbow or the back of your wrist. Before doing the procedure, we must ensure to provide privacy and controlling the temperature by closing the door or curtains, the fan, or the air cons. Ensuring also that we had cut our nails short to avoid harming the baby. And one of the most important thing on this procedure is do not leave your baby unattentively, ensuring that all your materials are within your reach.
For taking the baby, ensure that you have done the proper hand hygiene. Take the baby on the countertop on a cradle position. Undress the lower extremities. Check the diaper if soiled. So let's say the diaper is soiled, unfasten the diaper. Use the cleanest part of the diaper to wipe the baby from top to bottom. Put the diaper underneath the buttocks. Check if there's any redness or irritation and get cotton balls. Dip in water and clean the sides of the genital, including the labia, inguinal area, from top to bottom. Get another balls, dip and squeeze, and do the same procedure on the other side. Repeat till thoroughly clean, from labia down to the anus. Another cotton balls, dip and squeeze, clean the middle from the top to bottom and discard. Repeat until thoroughly clean from top to bottom, including the anus. After cleaning, take the diaper, fasten, put in a plastic, and throw on the garbage area. Cover the baby to avoid chilling. Get cotton balls, dip in water, and clean the eyes from top to bottom, upper inner to outer canthus, the lower inner to outer canthus, and discard. Do the same procedure on the other eyes. Take the cotton buds, dip in water, and clean the outer nose. Repeat the procedure until it's thoroughly clean. Get another cotton balls, dip and clean the upper lip and lower lips of the baby. Cotton buds and clean the earlobes and back of the ears of the baby. Repeat until it's thoroughly clean. Take a face towel, soap, and drain. Do a hand mitten fold and clean the face of the baby by a finger of 3. Start to the forehead, cheeks, down to the chin. Before shampooing the head of the baby, check the scalp if there is any redness or irritation. Get the basin with warm water. Put the baby on a football hold, supporting the baby's back by your arm, and in your dominant hand holds the baby's head. Cover the ears of the baby by your fingertips, or you can use cotton balls to avoid entry of the water. Wet the baby's head, including the occiput, and bath and dry. Expose the lower part. Undress the lower extremities. Get the towelette and do hand mitten fold. Clean the body parts starting from the neck from medial to lateral, abdomen from medial to lateral, arms starting from the axilla into the hands. Pay attention to the interdigital space of the fingers. Repeat the same procedure on the other arm. The lower extremities and pay attention to the folds and creases. Pay attention also to the interdigits of the toes. Turn the baby on the sideline position. Wet the back, including the buttocks area. Soak the baby's body from upper extremities to lower extremities and pay attention to the interdigital space of the fingers and toes. Take the baby on a cradle position. Place the body on semi-sitting position and start rinsing. Take the baby back on the countertop, bath, and dry. Take a clean cloth for the baby, dress, and put lotion or powder is an optional. May take now your baby back into her crib.
Hello everyone, I'm Donna Roxanne Marinas, one of the trainees of Nurse Caregiver Management Alliance, Batch 8 of 2021. Today's video, I'll be demonstrating on how to do an occupied bed making. On this procedure, we may need a top sheet, a bottom sheet, a draw sheet, a waterproof sheet, and a pillowcase. Before doing the procedure, ensure that you have done the proper hand hygiene. Identify yourself to the client, verify the client details, and explain to them the procedure and how they can participate. And the most important thing is provide privacy. Hi everyone, I'm Donna Roxanne Marinas, one of the trainees of Nurse Caregiver Management Alliance, Batch 8 of 2021. And today's video, I'll be demonstrating on how to take a vital signs. On taking a vital signs, it includes blood pressure, pulse rate, respiratory rate, oxygen saturation, and temperature. Hi sir, good morning.
Good morning to you.
I'm Donna, the assistant nurse. So today I'll be taking your vital signs. So is it okay for you?
Yes, it's okay.
Okay, but before that, may I verify your details first? May I know your name please?
Yes, I'm Elazar Yatiga,
Your birthday sir?
October 6, 1976.
Okay, it's correct. Now we're going to take our client's blood pressure.
The elbow should be extended and palm facing upward. Palpate brachial artery. Apply the cuff. Support arm at the heart level. Position the stethoscope near the brachial artery. Slowly pump the gauge at 180 or 200. Slowly release the pressure. You will listen for the first sound, which is the systolic blood pressure. List 4 when the sound stops. This is the diastolic blood pressure. Document the findings.
Taking the pulse rate and respiratory rate.
Take the pulse rate by placing 2 fingers in the pulse point. Count for 30 seconds for regular beats and 1 minute if pulse is irregular. Meanwhile, respiratory rate had been taken. Document the findings.
Taking the oxygen saturation.
Using the pulse oximeter, you may also see the oxygen saturation count. Document the findings.
Taking the temperature.
Sanitize the thermometer using a cotton or wipes before using. Place the thermometer on the axilla of the patient. Wait for a few minutes until the thermometer beeps. Remove the thermometer from the axilla of the patient. Sanitize the thermometer after using. Document the findings.
Sir, I have here now the result of all your vital signs. As I see here, your blood pressure is 120/80, so it's considered normal. Also, your pulse rate and respiratory rate, and your temperature is 36.5 as well. So you are healthy and there's no any problem on your health.
Alright, thank you.
Okay, so thank you. Hi everyone, I'm Donna Roxanne Marinas, one of the trainees of Nurse Caregiver Management Alliance, Batch 8 of 2021. And today's video, I'll be demonstrating on how to do a nasogastric tube feeding.
Prop the patient at least 30 degrees. Ensure that the recommended external length of the feeding tube is measured and consistent during each feeding. Check the tube if it is on the position and taped securely on the nose. Put a towel on the chest of the patient. Draw a stomach content and test the pH level of the content. Kink the feeding tube. Connect the syringe to the feeding tube and gently draw back the plunger to withdraw stomach content. If the pH level is below or equal to 5, he is ready to feed. Before feeding, flush feeding tube with 20 ml of water or as prescribed. By kinking the feeding tube, it prevents air entry into the stomach. Before connecting the syringe, position the syringe above the head. Shake the formula before putting into the syringe. Unkink the tube and allow the formula to flow slowly. Do not allow syringe to become empty during feeding. After feeding, flush the feeding tube with 20 ml of water or as prescribed. Ensure that the right medication is prepared. Crush the medication finely or dissolve the pills in a lukewarm water. Before feeding the medication, flush feeding tube with 20 ml of water or as prescribed. Pour medication into the syringe. After administering the medication, flush 20 ml of water or as prescribed. Keep your patient in an upright position after feeding for at least 30 minutes to prevent bad flow of the stomach content and clear all your materials after use.
Hi everyone, I'm Donna Roxanne Marinas, one of the trainees of Nurse Caregiver Management Alliance, Batch 8 of 2021. Today's video, I'll be demonstrating on how to do a PEG feeding.
Before feeding, flush the feeding tube with the prescribed amount of water. Attach the syringe to the feeding tube. Pour the formula into the syringe. You may raise the syringe for the feeding tube to flow faster, or lower the syringe for the feeding tube to flow slower. Continue to add formula to the syringe until you give the prescribed amount of formula. After feeding, flush the feeding tube with the prescribed amount of water. Remove the syringe and close the feeding tube port.